You're watching 27 First News with closed captioning brought to you by your local Ford dealers.
Well, in today's Family Focus, people who take brand-name prescription drugs could soon be seeing a price break.
Well, Dr. Michael Sevilla is here with us this morning for more information on these expiring patents of top-selling drugs. It's been a big story the last few days. Some big-selling drugs like Plavix and Lipitor that people have gotten used to are going generic.
That's right.
So what does it mean for people who take it?
Good news is it'll be cheaper, right?
It is cheaper, and what people don't know is for some of the medicines they're on now, they're probably on generics because the pharmacy can change a medicine to a generic if it's available at this point. So people may not even be knowing that they're on a generic medicine. What I tell people is that one of the first things that they'll notice is sometimes there could be a change in the color or the pill or the shape, even month to month, and they may say, oh, I think I got the wrong medicine. So it's something that people should really be aware of.
Boy, that makes it so much more difficult in today's day and age when a lot of people are on many, they're not just one pill, but maybe they're taking 5 or 6 pills a day to try to keep track of that as well.
That's
and then the names are all, you know, when they say Lipitor, and sometimes there's another name that's down there.
That's correct. That's correct. Yeah, it gets very confusing because, you know, even I get confused sometimes. Is it a generic name? Is it the brand name? And a lot of my older patients who are on 15 different medicines or who have family members who are handling the medicines for them can get very confused as well.
What's a good tip for them to try to keep it separated and know what is the right pill? I mean, I see a lot of them have the pill boxes.
Pill keeper.
So the pill
yeah,
keeper,
like Monday through Friday. That, yeah. But I guess it would be hard to identify if they're changing shapes and colors on you.
It is. It's very confusing. It's something that you need to work with your doctor about. Sometimes when I switch people over, you know, I bring them back a little bit more frequently. You know, are they having any side effects? Especially if it's a medicine that needs blood testing, they may need more blood testing earlier than they would usually have, especially with blood thinners or cholesterol medicines. So that's what people need to know about.
Yeah, let's talk about effectiveness, because sometimes they say the generics are not as good or not as effective as the original pill. Is that the case, and in which cases do you need to watch more closely?
The cases where I talk to my patients a lot are medicines that can be pretty dangerous, like blood thinners or depression medicines or seizure medicines and medicines that need blood testing. So sometimes they're not 100% the same, and people may get some side effects and things. So those are the medicines that I tell patients about.
Right. So basically, if there's a switch in the next few months and they see that, how should they monitor themselves to see if they notice, you know, maybe this isn't working quite like the old pill? What should they look for change-wise?
Anything different. If they have any kind of, you know, any kind of side effects, or if they just don't feel the same, especially when it comes to seizure medicines, depression medicines, they might not get the same effect that it did on the brand name medicine, and you need to tell your doctor about that immediately.
All right. Well, and how many of these pills are coming up as generics now that were just the brand name?
They're saying in the next 12 and 14 months, some of the most popular medicines out there, you know, like Lipitor, those type of medicines, people are take that a lot. So that's what I talk to my patients a lot about.
Right. All right. I do believe we're going to be talking more in the next hour. You want to find out, too, because they're going to all these generics, they're saying that it's causing problems for the pharmaceutical industry, and they may not do, you know, it may be bad for us in the long run, even though it's cheaper right now. So you can explain how that might be the case, and we could talk about that further as well. But we're going to go over to Rich right now with a look at the forecast. Good morning, Rich.